Hi everyone, I'm Dr. Justin Lin here at Rehab and Revive Physical Therapy. We're looking forward today to rehabbing your mind and reviving your body. A lot of you have been searching on our channel things about back pain, how to relieve back pain, especially our video about back spasms. That's done really well over the past few months. Today, our plan is to talk about the reasons one would have back pain. And my plan is also to give you the 3 best exercises to help relieve that pain. So stay tuned. If you search on Google or WebMD, you may find hundreds, maybe even thousands of different reasons that cause back pain. But when it comes to the real essence of lower back pain, essence of back pain, it boils down to 2 things: compression and torque. And usually it's compression and torque together, or compression, load, rotation. And that really starts affecting things like your discs inside your joints, as well as the nerves. A lot of these things really aren't just if you took something heavy and started swinging it and created that torque and load. It's just common habits. Things like sitting with your legs crossed, that's load. And when you cross your legs, guess what? There's torque. Side sleeping, a lot of times you're on your side, rotated, you're not really ever purely on your side. And rotational sports. Rotation! Like tennis, baseball, swimming can even create that. And then running. Let's talk about running because there's a lot of twisting and loading on the impact. So let's get to the 3 best exercises to help you get rid of back pain. So let's get started with the first of 3 exercises. I want to make a statement that we actually have these 3 different exercises on 3 separate videos that are more in depth. So if you have any questions, refer to those in the descriptions below. And I think that'll be a good way. But this is just how we would do it in a compilation. And we're going to do it a little bit quicker. But I want to discuss the pros and the cons and all that stuff. Because our lower back, there's a couple different reasons that can really happen. But we want to create the best exercises for you. So the first exercise is the lumbar decompression. Now, the goal of it is to get a little bit of traction and space along your spine. There's some populations that it's not good for, so check with your healthcare professional. And so largely it's going to be the people with a hot flaming disc. You know, it's like hot flaming Cheetos. You know, we don't want a hot flaming Cheeto in your back. So you want to avoid this exercise. But for the rest of you who've had chronic pain, yeah, this is a great exercise. So let's get started. You're going to need a handy dandy ball. It's going to be really important. And what we're trying to do is create an arch around this ball. We're going to use the force of the ball to kind of create some space in that spine. So we're just going to hang out over here. What I want to do is get on my forearms here, and then I want to kind of roll forward like a roly-poly, and then find a spot where I start feeling some release or some stretch, very light stretch. And then you can go side to side, or you can go front and back. You want to hold it, for a little bit, and until it feels about right. You don't want to hold it for like more than 5 minutes, but a minute or 2, pretty good. You can breathe into it as well. That's not a bad idea. You can breathe into it, press your belly into it, relax it, let it kind of get there. So that kind of creates some space, and we're looking for that space through here. All right. Great. It's feeling good. Now, when you get back up, you got to be very cautious because gravity is really coming down. So you don't want to do too much. Too much of anything is too much. So you just kind of hang out here, and then you can release the ball, and then you can kind of just move side to side, and then you can get up. So that's going to be the key, is that you don't load your disc too much. So that's the exercise. All right, the second exercise, arch and sag. The goal of this exercise is to provide a little bit more awareness in different planes, and then really trying to take these small joints in our spine and just kind of wiggle it around, get a little bit of lubrication. And that's the goal for this exercise. So let's get to it. What you want to do is you want to be able to kind of find your placement on your hands and wrists. If that's too much trouble, you can also do it on your elbows. It's just not as good. What you want to do is this is the arch, this is the sag. So cat camel is what we called it too, and this is just something my mentors have called arch and sag. Arch, sag. Now if you go forward, you'll hit the lower back a little bit. If you go backwards, ideally you're hitting higher. You can do the whole thing, but today's focus is the lower back. So we're going to go here. You want to maintain that arch. That's step one. Find that area that has a little bit of achiness or stretch. You might feel that. Then the second one is to pivot and windshield wipe your legs. So if you've got decreased range, that's another thought. So left is a little bit more range than right. I'm going to leave that there. That's step two. So I've locked that in. Then all you're going to do is you're going to sway from left to right, from right knee to left knee, right hand to left hand. And you're going to do that till it frees up. And all of a sudden, just gave a little bit. So let's try that again. And the more arch you can create, or the more sag you can create, is the name of the game. So let's go here. Once again, the right is the step two is right, and then we're going to sway left and right. And when I go to the right, it's a little crampy, a little tight. That's sometimes what people feel, but you can work in it and work out of it. And that gets better too. Then after the arch for some time, you want to do sag. So you're going to go here. You're going to go forward, find that area of tension, left, right. Today, it's on the left. And I note today because sometimes it's different from day to day, depending on your activity level. So maybe completely different. So same thing. I can get a little deeper into my sag or extension. And this one move to the right. Good. And that's pretty much how that goes. So the last exercise, we've got a lot of mobility from these two previous exercises. Now we want to take that spine and stabilize it. So we call it lift off.
Lift off. We have a lift off.
And this is something I created a few years back to really stabilize these small muscles that are in the spine. That's going to be the key. So let's get to it. You want to prop yourself either on your hands, this is the easier way, or the harder way is your elbows. I'm going to do it the harder way because this is what I've been doing at home myself. You want to keep your legs level, and the goal is to really just kind of elevate enough that you can slide a thin piece of paper through here. If you got to look at a different angle, you'll see that the goal is not to dip, twist, shear, or shift your weight too much. So there, let's check this out. And basically it doesn't look like a whole lot, but you can kind of see that I'm elevating this a little bit. And then you want to get there. The cue I tell people here at Rehab and Revive is to juggle a glass of water on your lower back and not even have the water inside that glass move.
Water, okay? Water. What?
So, think about that. And you should do both sides. So, the three exercises, we've got a little bit of the decompression that gives you a little bit of traction. We've got the arch and sag, which gives you a little bit of mobility, awareness of different things and different planes. And then we got to stabilize it with a little lift-off exercise. Help those little strong, small muscles along the spine. We're really excited to give this a shot. And this is a generic plan. There's specific stuff that, like I said, there's probably hundreds of different causes. You want to check with your healthcare professional, make sure that this is the right set of exercises that you can do, or maybe bits and pieces of it. But these are the three most common exercises that I give out here at Rehab and Revive. If you like what we're doing, we'd love your feedback. We'd love your subscription and your likes. If you try these exercises and they work, we'd love to hear about that as well. And then any comments that we can use to help improve what we're doing, our thoughts. And of course, as we keep pumping out new material, we keep trying to make it better and better. So we're really excited for future videos that we're really going to push out and really show to the public that we can do a lot more cool things to take care of your body at the comfort of your own home. So I'm Dr. Lin. Remember, we heal smarter, not harder.